This is the live Frankiecast with Isabel McGillicuddy. This is the video blog dedicated to the self-proclaimed coolest cat in the world, 5.5-year-old gray male tabby, Frankie Johnson. Here comes the show. Welcome to the live Frankiecast for Saturday, the 3rd of October, 2009. I'm Frankie's dad, Tom, sitting in for Isabel McGillicuddy. Frankie Johnson, the star of the show, had a dental procedure done yesterday in hospital. He had a dental cleaning, and unfortunately, he had to have 2 teeth removed due to the presence of kitty cavities. To learn more about this, and then to learn more about specifically what happened to Frankie, and hopefully how to prevent it, let's go first to Dr. Greg McDonald, and then after that I will talk about exactly what happened to Frankie. So take it away, veterinarian Dr. Greg McDonald, to talk about cat dental health. Dr. McDonald?
Hi, this is Dr. Greg McDonald, and I'm here with ExpertVillage.com, and we're talking about disease of your cat's mouth, mostly dental problems. And I wanted to go over with you some of the normal anatomy, things that you'll see on your cat's teeth that are normal. And then I have a special model that we'll look at that will show you some of the abnormalities that you might find in your cat's mouth if you look. Some cats are a little difficult to look at. It might take 2 of you to do that, so all you have to do is hold the cat's mouth open, and some cats that have been medicated a lot, they'll fight you, but work with them and just kind of peek every once in a while when you get them sleepy. So this is a normal cat's mouth, and again it's a model so that you can see the roots of the teeth as well as all of the other teeth that they have. And you can see they're carnivores, and they have these really sharp canine teeth that are designed for grabbing and killing their prey. And these other teeth in this area up here are really designed more for grinding. These teeth along this way. You can also see how deep that they have. All of their roots go deep into their mouth. And again, these are actual cat's teeth that have been mounted in plastic so you can see how they work. Those are all normal. Now I also have a model here that shows the abnormal teeth. Now on this side you see normal teeth, and if we turn it around this way you can actually see some of the disease that cats get in their mouth, and this is what you'd be looking for. This is actually an interesting one because they have an extra tooth right here. It's a baby tooth that did not fall out. It's called a retained deciduous tooth, and that causes some dental disease because the food gets stuck in between those 2 teeth, and those should be removed. You can obviously see there's some tartar on all of these teeth. The tartar in and of itself is usually not a problem, but you can see how red and inflamed these gums are. The tartar built up on the teeth has caused the gums to become inflamed to the point where they actually have gingivitis, and the gingivitis is actually exposing the animal's bloodstream to bacteria every day. On this area down here, you can see there's actually a broken tooth and an exposed root canal. On this side is a normal tooth, and so you can tell here that this poor kitty cat, if he was alive, was having a lot of pain with a tooth that was broken like that with an exposed root canal. So we're going to talk a little bit about what your veterinarian will do for this, but there's some also things that you can do at home to prevent your cat from having a mouth that gets looking this bad. Some of it's very interesting. It is actually genetics. Some cats need to really have their teeth cleaned no matter what we do every 6 months. Other cats do fine their whole life just on special diets. So look in your cat's mouth and decide if your veterinarian should have a look at it. I wanted to show you a live example of some gum disease in cats. This is a cat that's had dental disease, and unfortunately this poor cat is unable to have an anesthetic because he has a heart problem, and so we've been managing this medically, and it's really difficult to get good control on that in this cat. But it also serves as an excellent model so that you can see the problems that they might have if we don't take care of their teeth. Stripes, show him your mouth here. You can see that he's got a lot of gum disease up here. And then also there's a lot of tartar built up on this tooth, and he's got actually a hole in his tooth over here because the tartar's chewed a hole in his tooth on that side. if we look over on the other side, you can actually see he's missing a lot of teeth on the upper side because they've actually fallen out. If you'll let me, I'll open this mouth up and you can look inside. You can see he's got a lot of gum disease and a lot of disease going on in his teeth. So this cat would be an excellent category for a cat that should have his teeth cleaned. Unfortunately, we have to put him under anesthesia, and this cat has a problem with his heart that precludes that. We've actually tried twice in this cat to get his teeth cleaned and his heart stopped, so it's just better or unfortunate that he has to live with a tough mouth. But we are going to go into a lot of the details about how we look at the animal's health prior to putting them under anesthesia so that they can make it through without having a problem. So thank you, Stripes, for showing us your teeth, and we'll be back in a minute to talk a little bit.
What did Frankie have done exactly? Well, here, I'll show you. This is a very crude diagram of the lower jaw of a cat. These are the incisors, canine here and here, premolar, premolar, molar. Now, Frankie had in these two teeth here, premolar number 1, premolar number 1 here, he had what is known as a forl in each one of those. F-O-R-L, feline odontoclastic resorptive lesion, also sometimes referred to as just a resorptive lesion, or a neck lesion, or even a kitty cavity. Frankie had a kitty cavity in each one of these, a pretty bad one, so his teeth had to be removed. So now Frankie is minus this tooth and this tooth. Premolar number 1 in the lower right quadrant, premolar number 1 in the lower left quadrant. They're gone. Why? Because I'm a bad cat dad, that's why. So what to do? How do we prevent this? How do we be a good cat dad? Let's show him, Frank. Here's how you be a good cat dad. This is a toothbrush with some enzymatic cat toothpaste on it. And we're just going to pull back the lip here, and we're going to brush Frankie's teeth a little bit. Now, I'm not really going to brush them because he just had 2 teeth removed. So I don't want to do that, nor do I want to feed him any dry food for the next week. But after a week, he will be brushed. What's the other thing we do? We use some of this liquid right here, which I purchased from the vet, which helps to dissolve and prevent tartar formation. Just put a little on the tip of the finger and apply 1 drop there to the upper gum line on the left side, 1 drop to the upper gum line on the right side. This liquid will then disperse all throughout the mouth and help to prevent the formation of tartar in the future. So brush and apply, what is this anyway? MaxiGuard. This is MaxiGuard. It's an oral treatment for cats available at your veterinarian. 1 drop to each side of the mouth along the upper gum line 1 time a day. That will help prevent tartar formation, as will brushing. If you do those 2 things, you will not likely have to put your cat through what I had to put my cat through, which was general anesthesia, a tooth cleaning, and loss of 2 of his teeth. Thanks for watching another live Frankiecast. Let's close it out with the live Frankiecast feeding. Come on, Frank, let me get it in there. There we go. Tune in again this coming Wednesday, the 7th of October, 2009 at 8:30 p.m. for another live Frankiecast with Isabel McGillicuddy. And please brush your cat's teeth and do whatever else your veterinarian tells you to do. Right, Frank? How'd you like having your teeth pulled? Do you like that? Not so much. Thanks for watching, and as always, have a safe trip home.